Thank you, everyone, for joining us for another Learning Lunch hosted by FormatApproved.com. My name is Brian Johnson. I'm the Senior Director of Online Education with Format Approved, and I'll be your moderator today. Today's Learning Lunch title is Encrypting Hard Drives for HIPAA Remediation. We're joined today by Eric Rieger of WEBIT Services. Eric has worked in healthcare IT for more than 23 years. He's a certified HIPAA security professional and the founder and president of WEBIT Services, an industry-leading HIPAA-compliant technology service and solutions organization in the western suburbs of Chicago. WEBIT is one of the most, WEBIT sets the standard, I should say, for being a HIPAA-savvy IT service provider to medical clients. So we're really pleased to be able to share Eric's expertise on encryption with you today. I think we're all going to learn quite a bit here. So Eric, first of all, thank you for joining us. It's a real pleasure.
Well, thanks for having me. I appreciate it, and it's always great to be here. And hopefully we'll be able to have everybody walk away here with a little bit more education on encryption and why you need it and why you need it yesterday.
Absolutely. There's so many questions out there about encryption, so there's a real need in our audience, I think, to learn a little bit more about it.
I would agree.
Okay. Let's just look at the questions for today's session really quick while I go over some housekeeping notes. Remember that you can ask questions of Eric at any time during today's session by entering them into your chat area. In the second half of our presentation, we'll address as many questions as time allows. If you do run out of time, answers to all of your submitted questions will be posted to our website and sent via email link later in the week. So do watch for the follow-up to this event, because that will also include the slides of this session and a recorded version. So people often ask us, can we see the slides? And rest assured that we will send those out to you after the event, along with other resources that may be of use to you. So let's go ahead and get started. We've got plenty to cover today. I think this question, is sort of the most basic one, but people need to know it. What exactly is data encryption?
Yeah, I think this is a great place to start, Brian, with what I want to set the bar here for today is that I don't want to make this a very technical webinar. There's a lot of information out there about types of encryption, and we will discuss that a little bit in the next slide or two, but I want to kind of keep this as basic as possible so everybody gets a pretty good understanding of what we're trying to accomplish here. Encryption, by definition, the process of encoding information so that only people who should be able to read the information can read the information. So if you look at the little graphic that we have on there, on the first side you've got a simple message, hello, and then it gets encrypted, and in the center of the graphic you can see that the text that's there is illegible. It doesn't make any sense to anybody. And then on the other side, the recipient has a key that turns the information back into a message that makes sense or information that makes sense. So really what we want to do is think of this as a way to take plain, ordinary, readable text or information, turn it into something unreadable, and then give a key to the person who or entity who should be able to access that information. And we've got the little link down there at the bottom for our friends at Wikipedia, their definition on encryption, which we used a little bit here for deciphering this for everybody.
Great place to just get started and figure out the basics. So
Sure.
Are there different types of encryption?
There are, and this is where you could get kind of lost in the technicality of everything. For our audience today, I don't want to get too hung up on this, but there are basically three types of encryption that we've got here. You've got hashing, you've got symmetric cryptography, and then asymmetric cryptography. The hashing encryption method uses a fixed length signature, so there's a fixed length to the hash that is used to encrypt the message. Once the data is encrypted, it can't be reversed or deciphered. Hashing then is technically not an encryption method, but it's still useful for proving data that hasn't been tampered with. When you get into the symmetric or asymmetric cryptography, what the difference is in symmetric, there's a key that encrypts the information, and that key must remain secure because it's used by both parties. So let's say you and I are going to exchange information. We would both have a copy of that exact same key, and that key then has to remain secure so that if somebody else has that key, then they're able to decrypt the information that we're sending. In asymmetric, you have a publicly available key, so you make a key available to anybody that you want to have send information to you. That key is then used to encrypt the information, but there's a private key that only the receiving party has to decrypt that information. So there's pros and cons to each type, and depending on who you speak to or what manufacturer or operating system or software provider, everybody has a philosophy on how to encrypt the information. But basically it comes down to making sure that the key is not compromised, and we can talk about that a little bit more later. But these are the basic three types of encryption methods that we see used today.
So let's talk about the data then. What does it mean for the data to be in motion or at rest, in use, or disposed of? We hear these terms a lot. What are people talking about when they use these terms?
Sure. Well, there's four types of data that we could be talking about here when we're dealing with encryption. We'll start with in motion. So this is data that's moving through a network. Email, for example, is a really good one. So it's actively being transferred from one location to another. And in that case, you're going to want to have the information encrypted if it's sensitive information. And just to take kind of a step back here, when we're talking about this as it relates to HIPAA, for the purpose of this conversation, we're talking about protected health information, or PHI. The electronic version is ePHI, the E obviously standing for electronic, but that's what we're dealing with here. So when you have data in motion through a network, we're talking about stuff like email. If it contains the ePHI, you're definitely going to want to have that encrypted. Now, data at rest, that's data that's not actively being used but sits on a network or a device somewhere. And that can be in the form of a database where information is stored. It could be regular files on servers, such as like an Office, a Word document, or an Excel spreadsheet, things of that nature. Or what you see sometimes is people use flash drives to take data back and forth with them, or portable hard drives, things of that nature. So that data is not actively being used. It's not open, but it sits there on the hard drive of the machine, so it's considered at rest. Data in use is data that's in the process of being created, retrieved, updated, deleted. Now, sometimes you can get confused between the in use and in motion, but the same principle applies here. So if you're dealing with electronic protected health information, you want that information to be encrypted. Now, as it's in the process of being created, depending on where it's being created or stored is where the encryption process may take place. If it's at a database level through, say, like a practice management system, a lot of that, almost all of them nowadays, if it's going to store protected health information, it encrypts the data when it's in the database so that it's not legible. So if the database were compromised, it's encrypted. The information in there would not be readable by anybody. Now, flat files, things like Microsoft Office documents, a Word document, or an Excel spreadsheet, as those are being created, that's not being encrypted unless it's stored somewhere on a system that has encryption enabled on the device, like we're going to talk about down the road here. Now, disposed data. This is, the data that's been discarded now. This could be in the form of deleting files, or it could be when a machine is no longer needed and you send it out for disposal. And in this particular case, you don't necessarily have to have the data encrypted if you're dealing with a service that does electronic disposal in a HIPAA-compliant manner where it's certified. Because once the data's been properly discarded in that manner and you have a record of it, it doesn't matter if it's been encrypted or not, because it's no longer accessible in any way, shape, or form.
So here's one we hear quite a bit. Is encryption required by HIPAA, or what's the regulations say about encryption?
And this is where you can get a ton of discussion and back and forth. The technical answer is no. It's not required by HIPAA, but that's where you get into the required versus addressable conversation. It's addressable, and what that means is, and a lot of people get this confused, where it's not required, so it's addressable. Okay, that means we can ignore it, and that couldn't be any farther from the truth. What addressable really means is, if you're going to do something else other than what the recommendation is, you need to document your process and prove it's just as effective as what you're not doing, in this case encryption. So if you're not going to encrypt and protect the data that way, and you're going to do something else, you better be able to demonstrate that it's just as effective as encryption, because if there is a breach situation or something along those lines, the onus is going to be on you to prove that you did all you could to protect that data. And again, this comes down to, we're talking again specifically about electronic protected health information versus all data. So encrypting just the PHI or the ePHI can be done, but again, let's remember that if there is some type of a theft or loss or breach event, the onus is going to be on you to prove that all the ePHI or PHI was encrypted so that it's not a reportable event. So if you're just encrypting a portion of the information, the burden of proof is going to be on you to prove that there was no protected health information residing anywhere else on the device. So it really makes sense, from a realistic standpoint, you should just encrypt the entire device or the entire hard drive to protect all that data, because it's much simpler to do that than to bit and piece folders or files or certain structures in that regard.
Yeah, I was going to say,
down there.
I'm sorry, I know we're going to get into more detail here in a little bit, but my understanding is that it's generally going to be much simpler just to encrypt everything than to try to pick and choose what you're encrypting.
Absolutely, and we've got a link down there at the bottom to the security rule, where it does say, is encryption required, and the answer is no. But again, taking this into the bigger picture, if you don't do it and it's still an addressable line item here, what are you doing that's just as effective as encryption? And really, from a cost perspective and from a technology perspective, encryption is not as difficult to accomplish. If you're working with a provider that knows what they're doing. I mean, this isn't that difficult that you couldn't do it, and it's not that cost prohibitive where you have a lot of barriers to do it. Compared, especially with the fines, which we'll see later on, you definitely want to consider doing this as soon as possible.
Well, before we continue, I just want to remind our viewers that you will get these slides after the event, because we've had a question about that. Slides and the recorded version. And do feel free to ask questions now if you have them. We already have some from our audience. We're going to save those till the end, and then we'll get to as many as time allows. So let's talk about how people actually do encryption. Do providers need to get special software for this?
Sure. Well, again, this all depends, because there's a lot of different equipment out there, a lot of different devices, the age of the devices, the operating system that they're running, and again, the technical expertise of the people in the environment. So older devices, you're definitely going to need something, because the older operating systems and whatnot, they just didn't have that capability built into them back in the day. So we've come a long way in terms of technology, and I always like to joke that even while we're on this conversation today, there's probably 3 or 4 new things from a technology perspective we're all going to have to learn that are going to impact the way we use technology down the road. But there's some great software that's out there. There's some great some of the newer things that are coming out. There's BitLocker that is being built into Windows nowadays. So there's these things that you can do. But a lot of it comes down to centralized management. The number of devices you have and your quote-unquote data sprawl will come into play with this as well in terms of what the best methodology is for encrypting those specific devices. You've got things like your tablets now. You've got smartphones, all these portable devices. So that all comes into play when you're trying to figure out what the best way to go about doing encryption is.
And you mentioned here the last bullet on your level of technical expertise. I assume that some of these solutions are easier to implement than others.
Yeah, and it really comes down to, again, a lot of these other factors that play into it, the number of devices, the age of the devices themselves. Some of that can play into what choices are available for your specific needs. Let's just say you had an entity that had 500 users, and of that user base, you've got people with iPhones and Android phones and Windows phones and even some older BlackBerry phones. You've got to take that into consideration as well. And the bigger the sprawl is, the more technical expertise that's going to be required to implement a solution that's going to work for that entire environment. In a worst case scenario, you could kind of have to piecemeal things together, depending on how old your equipment is. It's always a good best practice to assume about a 3 to 5 year life cycle for any technology that's in the practice, from like a server workstation, mobile device, tablet, laptop perspective, because technology just changes so rapidly that by the time you're in that 3 to 5 year span, the technology to manage and do things like this encryption has evolved so much that the older devices just either they can't support it, or the overhead to manage it becomes more costly than just replacing the device itself.
That's a great point, that at some point, just from a cost-benefit perspective, you're so much better off just upgrading and moving on than trying to make something that used to work 10 years ago continue to work.
Well, you look at today, the Windows XP.
That's exactly what I was thinking of.
So that's out there. You've got, there shouldn't be any providers out there still using it, but you still see it today. People like, places like Target were using it. Home Depot still has Windows XP in their environments. It's a real risk, and you saw the Internet Explorer vulnerability that came out last week that Microsoft didn't have a patch for, and they said they weren't going to do any patching on Windows XP, but yet they did. And it just becomes a real cost burden to continue to support older equipment, and you might not be writing an actual physical check for it, but the soft costs involved in lost productivity, lost time, potential lost data, inefficiencies, those costs are real and they add up over time. And just the cost to replace some of these systems, workstations and mobile devices, they're not that expensive these days, and it really makes sense to have a budget strategy for that 3 to 5 year time frame, to where you're turning over these devices and doing it in a manner so that you're not falling too far behind in a technology curve.
So here's a great question. Is this something that providers can just figure out on their own, or should they really have help?
Well, that comes down to the old question is, it's possible, but I don't recommend it, because I know I work with a lot of providers, and I talk to them on a regular basis, and especially when we're going into a new facility and we're trying to see if we're a fit for them. The question becomes, and a lot of people have this misconception that technology is either so easy, to fix or maintain. Why would you want to do it? Is my question, because you've got enough on your hands to operate and maintain your practice, and there's so much from a healthcare perspective, so many improvements on that side to focus your time and efforts on. Dealing with this stuff, it's kind of a loss for everybody, because it's time you could be spending on the practice or on your patients, or there's so many other valuable things that they could be doing in the practice. leave this stuff to the experts. It's like I always say, I have an accountant. I know how to do numbers. I know how to keep a book, but I have an accountant. I know enough about the law to stay out of jail, but I have a lawyer, those types of things. Encryption is one of those things where if you do it wrong, you can render a device, or in worst case scenario, a network completely useless, and then you have problems because it's kind of like locking up the data permanently, and if you've got strong enough encryption on there, there's not enough computing power in the world to unencrypt or decrypt what you've done, and you could create a potential really big HIPAA issue for yourself if you don't have a good backup that you can revert to. So it's just one of those things that, the cost and time involved of the do-it-yourself for something that has the potential to go wrong in this regard and shut your entire network down, I would just leave this kind of to the experts, and that's just my opinion.
Yeah, I think that's a great point because, from a cost-benefit analysis perspective, if you're a provider, you want to be focused on providing care, not trying to sort of bumble your way through how to actually do this in the best way. When there's experts you should bring in who can do this. I think that's an important point. So what should providers understand about mobile devices and encryption?
Well, there's a lot of information out there about, like with Apple in particular, they tout that their devices have encryption capabilities built into their products, and they do. And again, some other devices would require third-party software to encrypt. Windows, the devices nowadays, they've got the BitLocker, which is built in, and that's all great. But when you have a variety of devices in your system or your organization, it really becomes a management potential problem when you're using different types of encryption or different platforms and monitoring, and who's turning it on and who's turning it off, who's making sure that if there is an event, it really comes down to if there's a lost or stolen item, how are you going to report and prove, if there's an audit, that you did have encryption turned on? And that's where a centralized management system really can help, mitigate any of those concerns. And you can prove beyond a reasonable doubt that you did have encryption, and you weren't relying on somebody that said they turned it on the phone, or thought they knew what they were doing and thought they had turned it on, but in reality they didn't. Now the phone was compromised, somebody got into patient records, and the information's public, and you've got a nightmare on your hands with a breach.
And I think something to add here that's important is, you mentioned here in the second point that the mobile devices that are lost are the source of many HIPAA data breach violations. And I mean, it's around half of them if you look at the wall of shame, where people have taken a laptop or something, and it may not be carelessness in a sense, in that a lot of these things are just stolen, not for the data, but just somebody wants to run off with the laptop. But if that data in there is unencrypted, then that's a major breach. If there's more than 500 records, that's reportable right away, and you're subject to all these fines. Whereas if that data is encrypted, it's not even a breach.
Yeah, absolutely. That's an excellent point, and this goes back to what we were talking about with data sprawl. As devices become more user friendly, more mobile, we're working from home a lot. We're taking our stuff with us when we go on planes, on trips, and people are just work all the time. And that's great that we have this ability to work from anywhere, but it really puts an emphasis on security. And there was just an article released, I think it was about a week ago. There was a study done that healthcare IT lags very far behind the rest of the industries out there in their ability to provide security adequately. And now we're not even talking about being best of breed. We're just talking about, the bar has been set at adequate, and healthcare IT in general is well below the adequate bar. And this kind of plays into that, where, you've got these user-friendly devices that make things easy. And when you make things easy, a lot of times it's at the cost of security. So introducing encryption on these devices really eliminates a lot of that worry about a breach. You know, I mean, I'm like just about everybody here, set a pair of glasses down and walked away and forgot about them. It's real easy with some of these really small devices to just forget that you had them, especially if you're in an airport or a coffee shop, or you move around from office to office, just leaving it lay there. It only takes one time to do that, and there's no malicious intent there. You know, they're not even stolen, but it just takes, you know, somebody to take that device and report it that it was found, and if there was no encryption on it, now it's on you to prove that there wasn't a breach situation.
And you hear those stories. They're sometimes heartbreaking. I'm thinking of one in Nebraska where a doctor had a flash drive on a lanyard, and he had something like 2,000 records on there, and he was just taking it around to work on it at home, and it fell off the lanyard. You know, these magnetic things, sometimes they just come off, and it came off somewhere. He had no idea where it was. It was lost, and that was a major breach because none of that data was encrypted.
And you're right. A lot of times these issues are where providers are just trying to go that extra mile, and we know everybody's getting squeezed on all ends with, you know, from the healthcare spectrum. So people are working longer hours, and they're taking information home, and they're trying to do whatever they can to continue providing the best care. And there's no malicious intent involved whatsoever. But you know, when you make things this portable, such as a flash drive or even a small hard drive or a mobile device like a phone, they're real easy to lose. You know, stuff just gets lost, and you know, especially when you're working 10, 12, 14 hours a day, you know, towards the end of the day, you're not necessarily at your sharpest, and you just kind of want to get things done, and stuff happens.
Well, and one other thing I'll add is that I just saw a study recently that said something like 87% of ambulatory practices now have bring your own device presence in their network. In other words, people are using their phones, their own phones, in the network, which obviously is a major security vulnerability.
Absolutely, and we could probably do a whole webinar on BYOD, bring your own device, and if you don't have the proper policies and procedures in place for that, you know, you could be opening yourself up to a lot of potential problems. Not even necessarily just from a HIPAA side, but from just a regular you know, legal issue side of things, where, you know, somebody leaves, they quit, they get fired, and if you don't have a policy and procedure to know what devices have been given access to the corporate network and have control to make sure that that gets shut off correctly, you know, you could have another issue that way, and then you tie in, you know, the HIPAA and the encryption and all that. It can be a real mess. So yeah, as technology has gotten easier for people to use, it's created a lot of issues for IT on the security side. And this goes back to the whole argument that people were saying cloud was going to eliminate the need for IT, and really when you step back and look at it with how easy it is to access some of this data, it just makes IT even you know, more responsible for the security of that information.
That's a great point. So here it looks like we've got an example of some of the things that have happened. Do you want to just tell us a little bit about what this example is?
Yeah, I pulled this off of HHS's website just to show. I mean, this is, you can see the date on this is fairly recent, April 22nd, and this kind of goes to what they're saying specifically. If you look at that second paragraph, covered entities and business associates. Now, that's an important part here. If you're a business associate, you're just as liable here for the security of the devices here. So covered entities and business associates must understand that mobile device security is their obligation. Our message to these organizations is simple. They're spelling it out here for you, everybody. It's encryption is your best defense against these incidents. So it doesn't get any more clear from that. And usually when you're dealing with OCR or the government and any of these things, a lot of the stuff can be very ambiguous, and a lot of that's by design. But if you look here, there's 2 separate incidents here, and it results in almost $2 million in fines. So think about that for a second. We just have 2 separate incidents where devices were lost or stolen, and these entities have agreed to pay almost $2 million in fines. Encryption would have made that go away. And these are just the fines that they're paying to for these specific incidents. This doesn't also include any credit monitoring that may have to be paid for, the notification to any patients whose information may have been compromised. So this is just the fine. There's a lot of additional cost to this, and we're not even talking about the reputation hit that these places have taken because of these incidents. So, for a very small amount of money to encrypt devices, you can make all these problems go away fairly quickly.
Yeah, not to mention the fact that there's liability here. So it seems like the larger breaches now almost inevitably lead to a class action lawsuit that can be millions of dollars on top of those government fines.
Well, and if you look here at the last paragraph too, it says OCR received a breach notice in February of 2012. So this just came out now in 2014. So that's kind of how long the process can be. Now they're trying to speed all this up, but you can see that this drags on. Now, if you're under investigation and you have an audit going on, I mean, this is added stress and headache for everybody within the organization that drags on for, almost 2 years here. So there's a cost to that as well. And I mean, it's not just about the fines. Even if you are audited and it has to drag on this long because you can't prove you were doing what you were supposed to be doing, even if you don't get fined or you get a small fine, the cost of dragging this on for potentially a long time is always there, and that can be almost as bad as a fine. I mean, not in this particular case for $2 million, but still, I wouldn't want to have to go through this for any protracted amount of time.
Well, I love this example. I have not actually seen this press release, and I follow HIPAA pretty closely. But that message, as you're saying, like the government almost never says things in clear-cut terms, but you couldn't get clearer than that. Our message to these organizations is simple: encryption is your best defense. I'm going to get a tattoo that says
right
that.
There. Or T-shirts.
Maybe T-shirts would be better.
Well, yeah, because the message always changes from the government. So
yeah, there you go.
Because we can always get new T-shirts.
Okay, good thought. But yeah, there's the message. Very simple.
Yep.
Okay, so let's talk about encryption and communications, whether you're talking about email or text messaging. What should providers do for that?
Well, it's the same principle for, we're still talking about electronic protected health information, so that should be encrypted. And again, if you go back to, does HIPAA require it? No, but if you're doing something else, you have the burden of proof is on you for whatever alternative you're using. It has to be as good or better than what the suggestion or the addressable issue is. So if you're sending electronic health information in an email or a text message and it's not encrypted, there's a real good chance that that could be your source of a breach. And remember, every single communication where that information is sent, that's one occurrence. So if you're sending a lot of emails and you're not using encryption, that's a potential right there for a lot of issues. Text messages in particular, because that information is stored on the carrier's networks for a period of time of up to a year, sometimes even more. And you've seen with the things going on with NSA in terms of reading people's emails and reading text messages and communications and all that. If you've got a system where you're actually sending protected health information through text messages, you have no idea how long or where that information is going to sit or who has access to it. So, there's some good tools out there on both the email side and the text message side that can provide the encryption. Now, the downside to this is, with email, regardless of what system you use to encrypt the information, it's going to create an extra step for the end user the first time they receive an encrypted message, because it's not like it just encrypts it in the email and then when it gets to the inbox it's automatically decrypted. Basically the way most of the systems work is it will send the recipient a message saying you have an encrypted message, you need to create an account and log in here, and then you're able to retrieve it. With text messages, it's kind of the same thing where the recipient has to have the same program on their device in order to receive the message. So it's that whole balancing act between convenience and security, And unfortunately, when we're putting security first, convenience sometimes takes a back seat. So it's not that it's that difficult, but there are some potential barriers that patients may not like. And the one thing you can always do is, if a patient says, just send it to me, just get it in a document that they have basically instructed you to do this, that you've made them aware that this is not a good idea, and then that releases you from any potential liability for that if the patient has signed off on that, because that's what we instruct the people that we work with on. If somebody is specifically requesting their information in a non-secure fashion, they can sign a document that says, we understand this is, not a good idea, but we don't care. Send it to my Gmail or send it to me in a text. And as long as you have that document to refer back to, that will prove that the patient requested this in this manner, and you're off the hook, basically.
This is a question that I think many people have, and so tell us a little bit about how people should expect encryption to affect the performance of their hardware.
Sure, and this kind of ties in with the previous discussion we had about what kind of infrastructure. So it really, there's a lot of variables that go into this. The age of the device and the computing power that it has is really going to play a key role. Without getting too technical, older hard drives spin at a slower rate than newer hard drives do. So the slower your device, your spin rate, and then you're adding a layer of encryption on it, it could impact the performance. Now, if you have really old devices and you put encryption on them, it could bog them down to the point where it might make them not usable anymore. So this really kind of goes hand in hand with that 3 to 5 year rule. The older the device, the more chance that you have where encryption can impact the performance. Now, newer systems, all the stuff that's coming out today, it's all designed to work this way, because security is at the forefront in the tech sector. And the hardware vendors and software vendors, they're designing everything to work in as secure a manner as possible. So and the type of encryption and the software, or if you're using something built into the OS, that plays into, operating system, I'm trying to stay not technical here, that plays into what kind of performance you can expect. Now, if you have newer devices and newer infrastructure, the impact will probably not even be noticeable. But again, there's a lot of factors that go into this on whether or not you're going to notice any kind of a performance hit, when you turn encryption on.
So how can a provider go about evaluating what their needs are?
Well, this is where I think anybody who deals with HIPAA from a technology perspective, everything starts with a risk analysis. And basically, if you're not doing a risk analysis on a yearly basis, you really should start doing one. That's going to give you kind of a big picture detail here of where the holes in your systems are. So once you have an idea of what your big picture risk is, you can develop a strategy to start working from the outside in. In my opinion, your mobile and portable devices, anything that's not tied down to the network, is your biggest risk, because if it's leaving the organization, there's where the greatest chance is. And if you look back, like we were just talking a few slides ago about the reports where all these fines are coming from, you see most of it is around mobile devices, laptops being left in cars, or like you said, a flash drive breaking off a lanyard. So I would start with getting a good handle on how many of these devices you have in your system, and work on a strategy to protect from the outside in. Because the likelihood of a break-in and a theft of the computer equipment inside an organization is less than the likelihood of leaving a laptop or having a laptop be stolen, or a tablet, or a flash drive. So you start from the outside and work your way in. Now, if you have older devices and equipment, you're going to want to take that into consideration, because just flipping a switch and turning encryption on, and it really isn't that easy, but If you do that, you may have some serious system degradation. So you really want to take that into consideration as well, and you may have to upgrade some of the hardware before you can think about turning encryption on. The next point is, okay, you've decided you're going to do this. Now, who's going to be responsible for managing the encryption? So you've got policies and procedures that need to be in place. Are you going to have a central counsel to manage this? Who's responsible for that? What happens if that person is sick, on vacation, leaves? So there's a lot to consider from a management perspective as well, because if somehow a device becomes inoperable because it can't get the key to decrypt when you log in with your password, who's going to handle the support of that as well? So there's a lot to be taken into consideration from a management perspective. And the other thing I would do is, from an internal perspective, if you've got servers, you can start by locking the rooms that they're in until you can introduce encryption, because you don't want those compromised or stolen. And if somebody does happen to gain access to your facility, at least you have the servers locked up in a room to make it a little bit more difficult for those devices to be taken off premise. So this is kind of like a starting point, to get you going for what your particular organization needs.
Yeah, and I think that last point is a great one too, because we've talked about laptops and getting stolen and phones getting lost and things like that, but also there have been major breaches that have occurred where someone, sad as it is, has just broken into an office and taken a desktop computer, and if that desktop computer has unencrypted PHI on it, well, you're still in trouble, even though it's a theft.
Well, and that's a point that I don't think we touched on a little bit here, but in terms of encryption and how this works, just from a high level, when you encrypt a device, because a lot of times people can confuse passwords with the equivalency of encryption, and a password does not encrypt your device. It just prevents somebody from logging into your particular device when it's powered on. If someone were to break in and let's say they stole your server and they didn't have the passwords, and the passwords were complex enough where they couldn't log in, you could just open the case and pull those hard drives out. You can plug them into another different type of system that can read those drives, and if they're not encrypted, the data on there is in plain text and it's easily accessible even if you don't have passwords to the operating system. So that's kind of like a really important point I don't think we touched on enough.
Yeah, that's a great point.
Just having complex passwords on your systems doesn't protect you in the event of a compromise of the actual system, because once somebody with any kind of technology know-how has access to the drive itself, there's a lot of tools and software on the market or on the underground market as well that you can use to pull data off of a drive if it's not encrypted. So it's a multi-layer approach here. And we also put at the bottom there the NIST guidelines for encrypting devices, because when you're looking at a potential audit situation, again, even though encryption's not required, NIST publishes guidelines for anything that's required or addressable. So if you're going to do an encryption strategy, it's really good to use this as a guideline, because that's what an auditor's going to look at if you're ever in that situation.
And I'd just like to remind our audience that we are going to send out these slides afterwards, so you don't have to furiously scribble down that URL if you want to look at these resources. You'll be able to look at these here in our follow-up email and click on them and look at all that at your leisure. Well, you've saved plenty of time for questions and answers, Eric. We appreciate that, because we've already got a lot of questions from our audience. Very engaged audience today, so we're happy to get to some of those questions. And then we'll talk about some of the resources people can avail themselves of here on the screen. Again, you'll be able to click on these links in the follow-up. But let's go ahead and look at some of our questions from the audience. Okay, here's a great one. If you're using mobile devices, how do you ensure that users don't mess around with the encryption system? Is there something you can do to sort of make sure they don't turn it off, or what are the options?
Yeah. This kind of ties into with the bring your own device. So the first part of that question would be, do these devices belong to the user, or do they belong to the organization? So that's step one. to take into consideration when you're talking about this. Now, there are tools out there that will allow you what's called mobile device management, so that the organization or the IT provider that's providing services can put an agent, per se, on the device, and then that agent can set policy for each of those devices that can prohibit or allow users to do certain functions. And that's where this whole bring your own device kind of muddies the waters, because if somebody owns their device, they may not want to have an IT managed piece of software on there to prohibit them from doing things. But the flip side of that coin is, if you're going to allow that device to connect to your network and do corporate or business level or practice level things, you really need to have good policy and procedure in place to state exactly what the expectation or lack of expectation the user has for that. So there are tools that can do that, but it really comes down to who owns the device, what the policy and procedure is in place, and then what tools are being used to manage those particular devices. So it's a great question, but you know, again, this is where the waters get a little muddied for allowing people to bring their own devices into the office.
Yeah, and as you were saying, I think that's a great answer. It really comes down to setting policies so that there's a clear understanding of what the expectation is and what the rules are going to be around those. I know that some phones now, there's sort of a corporate side to it and a personal side to it, and if necessary, you know, the IT manager can lock or wipe out the corporate side. So there's options out there, but you really need to look at what works best for you as a provider.
Absolutely.
This is kind of a general question, but maybe you can address it anyway. The question is, are software vendors responsible for the technical aspects of HIPAA?
Well, it depends on their access to electronic protected health information. So if they're providing direct support and their support people may have access to devices or systems that have protected health information on it, then they're considered a business associate, and you need to have a business associate agreement in place with them. Now, if you're using an IT provider who's bringing those services in through a third party, the IT provider would have a sub-business associate agreement with whoever the vendor is bringing that information in. So the direct responsibility for HIPAA always falls on the provider. I mean, there's no way to remove that liability or responsibility. You're responsible for HIPAA. Now, there's a shared responsibility from the vendor's perspective, and it really comes down to whether or not the services or software they're providing has any direct impact with protected health information, or I'm sorry, direct access to protected health information. So it really depends on a vendor-to-vendor basis in terms of what their access is to that particular data.
All right, here we have a question about HIPAA-compliant email. Even if the patient requests something be sent to them and their email is unsecure, that doesn't exempt the provider from sending it from a HIPAA-compliant email, does it? My understanding is that the provider email must be HIPAA-compliant to be creating, sending, and receiving EPHI.
Yeah, there's a real good article that Mike Semmel put out about the myths and facts of email and HIPAA compliance for email, and we can make that. I believe we can make that available in the when we send out the slides here.
Certainly.
But just to kind of recap, you know, from a best practice standpoint, you absolutely, as a provider, you want to be using a HIPAA-compliant email system. But the law does state that if the patient has requested you to send the information to their Gmail, as long as you get that documented, that, you know, Gmail, you know, we all know Gmail's not a secure system. There's no encryption as of today. Now, Google's been talking about just blanket encrypting email because of all the stuff that's going on with NSA and NSA reading people's, breaking into servers and reading people's emails and text messages and things like that. But as of today, you know, if you send information unencrypted to a person's Gmail account, you know, you have no idea, you know, and that goes for Hotmail and any of the AOL, any of that other type of email, free email systems. You have no idea what's going to be read. So let's just say you sent something to the patient and you used your HIPAA compliant email system, and it sends them an email that says you have a new encrypted message, and they say, take that off, I don't want to see that anymore. As long as you keep that in writing and make them aware and say, you know, this is not a best practice, you really shouldn't be exposing your information, and they say, I don't care, I want it sent to me, that way you can't deny them access to their information. So I would keep that information in record, and then once you have that on file, you can then send that to them without the encryption enabled. And again, it really depends on the service or the system you're using, whether or not you, as the end user, have the ability to turn that on or off. So I can't speak to any specific situation, but there are some systems that allow you to encrypt by typing a keyword in the subject line. There are some that just look for keywords or key phrases. They have HIPAA templates, so that may not be an option, and it comes down again to your practices, policy, and procedure for what you specifically do. But at the end of the day, if the patient comes back to you and says, I don't care about this stuff, I want it sent to me in just plain email, you can send it to them that way and not have any concerns about liability, as long as you keep that information on that patient's file.
Yes, document, document, document when it comes to that stuff.
Absolutely.
Here's a question about BitLocker. The question is, and you mentioned this is the Windows encryption that's native to, is it the professional versions only? Well, that's a separate question. I'll let the audience member ask their question. Maybe you can address that too. Will BitLocker do the job as it relates to encryption? If it's not enabled, would we be seen as being negligent?
Well, and that comes back to, again, the whole corporate structure, because only certain versions of Windows are enabled with that, and it's all the newer versions from Windows 8, and you are right, I believe just the professional versions have that. I would have to double check on that. I don't believe the home editions have BitLocker. They may, but I'm not sure. We don't deal with that in our environment. So I believe that they don't, but we can double check on that. Yeah, I'm not really well versed in the home editions of operating systems because we don't allow those in our environments. But you know, BitLocker, having it and then not turning it on, I mean, it's the same thing as not having encryption on any device. So it's really not a BitLocker conversation per se. It's whether or not encryption was enabled. So it comes back to the whole, when you're planning out your strategy for how you want to encrypt. You know, if you have all newer Windows devices and you can turn BitLocker on, then absolutely, by all means, you want to do that. But not having it on, it's the same risk as not having it on an older operating system as well. I hope that answers the question.
All right, and I want to remind people that, you know, if we don't get to all of the answers to these questions, we're going to give Eric a chance to address some of this in writing, and there's going to be a lot of resources in the follow-up as well. I think we may have time for one more question, and this is a good one. The question is, why would anyone want to steal health information anyway?
Well, it's not so much when somebody's stealing a laptop per se, or somebody's breaking in to steal it. The healthcare information may not be the main motivation. I mean, people steal for all kinds of different reasons. If you leave your laptop in an airport and somebody just thinks they can get away with it, they've gotten away with it. So if you lose the device, the burden of proof is on you to prove to the government that you protected the information that's on it. So the target may have been the device itself, but because there was the potential for PHI on it, the burden of proof shifts back to you to prove that you had it protected. So the target isn't always necessarily the protected health information. There is, you know, the whistleblower law was enacted, so anybody who can report HIPAA violations, if it's proven and there's a fine, there's the 10% motivation. So there's always that in the back of people's minds if you are wired that way, and that's what your goal in life is to make the other people's lives miserable. But believe it or not, there are people out there. We've already had a couple of people that we work with that have had to deal with those types of situations where not even from a theft, but just from information that was exchanged. You know, there was threats of lawsuits and things like that. So just remember, the burden of proof is always on you the owner of the systems and the data to prove that you've done everything in your power to protect. And we go back to that plain as day from OCR. Encryption is the simplest, easiest way to prevent that information from being compromised.
Yes, because then if someone takes that laptop because they want the laptop, well, they can't get access to that data, so it's not even a breach. And I think you're absolutely right in saying that most of these thefts that result in breaches, the person stealing the hardware doesn't care about the health information at all. They're just trying to get the hardware itself. But because the provider has that obligation to protect that data, it's on them that someone actually got access to it, even if they don't use it.
Absolutely.
The one other thing I would add to that is that there are indications that more and more kind of identity theft around healthcare is also happening. The advisory that went out recently that you mentioned before about healthcare lagging behind, they noted that health data sells on the black market for a lot more than just, say, credit card numbers do, because you can use it to really get credit cards. You know, it's got birthdays, so sometimes social security numbers, all this data that's valuable. So although I think that's a small part of the picture at this point, it is a rapidly growing concern that you've got people maybe overseas trying to get access to data, and if they can use it to take out credit cards too.
Exactly, and that's a great point. Is the value of that information once it's found? You know, you can use a lot of that information from an identity theft perspective, because you basically know everything you need to know about a person to set up an identity for, you know, take their identity basically.
Yeah, it's a gold mine for people who are trying to do that. Well, we're nearly out of time, so we want to just tell people a little bit about some of the resources they can take advantage of. First of all, I want to urge people to check out Eric's and WEBIT Services website. Go to www.webitservices.com. I think you can see just from this presentation that all IT service firms are not the same, and that if you're looking for someone who can provide you really full services, who really understands the needs of medical clients, you couldn't do better than WEBIT. So do check out WEBIT Services if you're in need of those services. Thank you so much for being with us today, Eric. This is a great session. We had great feedback from the audience. I didn't read all the comments we got because we were focused on questions, but this is obviously very useful to people.
Well, great. Thanks, Brian. I'm glad that people are able to get some value out of this. And it's always a pleasure being on here, you know, having these conversations with you, because that's part of our core values, is just making sure that we're educating people, even if they don't do business with us. That's irrelevant. You know, we just want to make sure, you know, especially like you said, with healthcare technology lagging so far behind, you know, even if we can educate other IT providers out there, you know, we're doing a good service to the community, and that's part of who we are.
Absolutely. Well, remember, everyone, that we're going to send out a follow-up email, as I've mentioned a few times, and people have asked, you know, are we going to get the recording or is it just the slides? We're going to give you both, so you'll get the slides and the recording. You'll also be able to go to WEBIT's site and see the recording if you want to look at some of what they've got over there. So do look for that follow-up email. I'd like to announce this new HIPAA workshop that we're launching here at Format Approved. We have Format Approved online courses. Some of you may know about that. But we're now, for the first time, launching our first ever HIPAA workshop. In 1-hour sessions over 4 days, we'll cover all of the content that's in our Certified HIPAA Security Professional course, including everything you need to know to serve as the designated security compliance officer. And as you may know, HIPAA requires that every practice designate one of those folks. So you'll have access to all of the materials included in our regular CHSP course, and you'll be able to participate in the live sessions and ask questions and have all the advantages of a classroom setting. If you miss any of the live sessions, we're also going to post the recordings to our learning system, so you'll still be able to access them even if you miss the live session. Best of all, you can take a $50 discount on this course through WEBIT Services. So if you're interested in this, if you think this would be a good fit for you to learn more about HIPAA, do look for the follow-up, where we'll include links for you to go through and take advantage of that discount. Visit formatapproved.com to learn more about our upcoming learning lunches. The Learning Lunch button will take you to our upcoming webinars, where you can learn more about them and register. Our next Learning Lunch will air tomorrow and has the title, The HIPAA Security Risk Analysis, Pros and Cons of Self-Assessment Tools versus Expert HIPAA Report Guidance. So do join us for that session if you can. Keep an eye on your email box on our homepage for other upcoming topics, and thank you again to everyone for joining us today.